Hi, we are Team 1 and we will be discussing the current state of primary care and the Affordable Care Act along with considerations under the new administration.
The Affordable Care Act was built on three main objectives: reform the market for private insurance, expand Medicaid to individuals earning up to 133% of the federal poverty line, and to alter the way that medical decisions are made. The reform of the private insurance market included the addition of the individual mandate, which requires all individuals to purchase health insurance or otherwise pay a fine. The change in the way that medical decisions are made included the development of reimbursement methods for new delivery systems such as telemedicine. Today, under the Trump administration, the ACA is still the law. However, it has been reshaped through legislation as the administration has attempted to completely repeal the law, but failed to do so under a single legislative act. One of the biggest changes in 2019 is the change to individual mandate. Now, if a person does not buy insurance, the fine for this is $0, which is estimated to keep 3 million Americans from purchasing health insurance. This administration has slowly been decreasing the strength of the law by decreasing fines, expanding access to health care plans that are not impacted by the ACA's rules, reducing Medicaid spending, and expanding the use of health savings accounts. Primary care was developed with four main purposes, including being the first contact in patient's care and providing comprehensive, coordinated, and continuous care. Primary care has seen a drastic change over time through cost control pressures and changes in the reimbursement structure. Historically, primary care consisted of the majority of doctors and was the first person an individual with an illness sought out. However, this is not the case today.
The state of primary care has changed significantly to get to where it is today. Currently, primary care physicians are inundated with patients and are struggling to provide proper service to match the country's needs for primary care. More and more, medical students are seeking a career in a specialty because of its greater potential for financial earnings and lifestyle it provides. As a result, many telemedicine, urgent care, and retail clinic centers are taking advantage of the maldistribution and providing their own cost-effective version of primary care. In the future, the maldistribution between primary care physicians and specialists will continue to grow. Students will continually favor choosing specialties rather than primary care. The need for these providers will instead be filled by nurse practitioners and physician's assistants, who can provide a similar scope of care. There will continue to be a shift favoring quick, cost-effective care through clinics and telemedicine services. In addition, whatever political changes occur within the next few years, specifically this coming election cycle, regarding healthcare and policy will greatly impact the way primary care practices handle the financial aspect of patient care.
To look at the future of the Affordable Care Act, we need to look at the political frontrunners to see what their plan is, since they will be the ones actually making changes. For the Republican Party, Trump will be the nominee, so let's think about what his plan actually is. We know since he originally ran for his first term that he has wanted to remove the Affordable Care Act and repeal it. But how does he want to do this? He wants to start by using reforms that would expand choice, increase access, lower costs, and at the same time provide better health care. A few of his proposals to do so included interstate sale of health insurance, health savings accounts, and tax credits. During his first term, Republicans have been in the process of repealing the Affordable Care Act, but it hasn't worked the way Trump had hoped. In fact, Republicans have had more success in gradually undermining the reform than making a major change. Trump has done a few things, however. He used his executive authority to withhold payments to insurers, to restrict advertising of the ACA-covered insurance plans, reduce time for open enrollment, cut funding for in-person assistance, and open ACA marketplace to insurance plans with low actuarial value that covers a narrower range of essential health benefits than other plans. However, the Affordable Care Act has hit its highest level of favorability during and immediately after the repeal fight during Trump's administration. In essence, a few things have changed, but overall there hasn't been a ton of major changes. As for Trump's plan, he said himself that he predicted that the Affordable Care Act will implode and that it would be necessary for a Republican-driven reform to then arise. Next up is Elizabeth Warren, who's currently a frontrunner for the Democratic Party nominee. So what exactly is her plan with the Affordable Care Act and healthcare in general? Overall, Warren tends to avoid putting her specific opinion about healthcare in print. She co-sponsored Bernie Sanders' Medicare for All bill in the Senate, but she's also co-sponsored a few other bills that offer substantial but less sweeping reforms in terms of healthcare. Her plan includes stopping the Republican assault on the Affordable Care Act. She wants to keep that intact and tell her plan for Medicare for All to take place. She would expand coverage and strictly regulate insurance companies, which over time would ultimately move to a Medicare for All to cover everyone. However, would her opinion change since recent polls have shown that there is less support for Medicare for All and more towards Medicare for anyone, which would be a voluntary system that would make public insurance cover more, but it wouldn't be mandatory? Warren has released detailed plans for several hot topic political issues, but hasn't released any for healthcare yet. So we'll see if she moves away from Medicare for All or if she remains in support of the ACA for at least a little bit. Joe Biden is the other frontrunner for the Democratic Party nominee, and he was in office when Obama enacted the Affordable Care Act, so how has his stance changed over the past 4 years? His healthcare plan is essentially an Affordable Care Act 2.0. It would include the most popular parts of the ACA, from Medicaid expansion to protections for patients with pre-existing conditions, and build on them with a new government-run public insurance option. Biden wants Medicare to directly negotiate drug prices. It would allow the importation of prescription drugs from abroad and extend tax credits to help Americans buy lower-priced health insurance. His plan would cost a whopping $750 billion over a decade, which he claims would be paid by reversing some of Trump's administrative tax cuts. His plan is less transformative than the Medicare for All proposals, but it would effectively do away with private insurance and shift all Americans to government-run health coverage. He stated that he understands the appeal of Medicare for All, but he said that it would mean getting rid of Obamacare, which he does not want to do. His plan starts with the Affordable Care Act as a base and is going to add elements that Obama wanted in the first place, but he believes that it will work this time. His plan would allow for all shoppers on the individual insurance market to qualify for premium tax credits. This would allow undocumented immigrants to purchase coverage in the ACA marketplace, but they would not be eligible for federal subsidies. In essence, Biden believes that building on the Affordable Care Act is the quickest way to get people insured and to improve affordability.
Now that you know a little bit more about primary care and the Affordable Care Act, do you have any ideas as to how we can slow down the rate of maldistribution between primary care and specialties? Do you think we should continue to implement the Affordable Care Act? If not, what do you think is a reasonable solution to our country's issue of inaccessible health care?